So hospice versus end-of-life doulas or death doulas. So these two kind of can overlap, but I do think that they can work well together. Hospice, I am a certified hospice nurse. And with that being said, I know that some clients that are on receiving end-of-life care, hospice care, when they're visited by different disciplines and things such as that, they are limited by, Medicare guidelines where they only have X amount of hours, maybe even 1 hour to be with that patient. So I kind of come in and fill that gap in. We collaborate together and just work together to provide the best care for that client and their family. And here I have a side by side of some things that hospice does and then what end of life doulas do. So on the hospice side, they plan the medical care. And with a death doula working alongside that hospice agency, will reinforce the medical care plan by hospice. And I mentioned briefly that hospice is a Medicare benefit. It's covered 100% by Medicare, whereas death doulas, they're all private pay. And for hospice, there are licensed roles, licensed clinicians, technicians there. With end-of-life doulas, there is not a national board yet that regulates, what doulas do and how they can perform their practice. Although there are many different trainings that you can take to become a doula, with the National End of Life Doula, there's a code of conduct that is we all tend to follow. And that's just pretty much just maintaining our professionalism and providing the best care that we can. And so with hospice, again, the care is clearly defined. There they have a medical director, they have a case manager, they have other members on the team, and they kind of review every couple of weeks or so, the progress that's being made, what needs to be done, if there are any changes that need to be made. So for death doulas, again, it just depends on that training that individual has. But again, we will also always support the care plan that was presented by hospice. And then finally, we know hospice provides clinical care, whereas doulas, mostly they're non-medical care and provide just practical care.